prioritize getting the suicidal ideation behavior under control first, perhaps with lithium, and then look at other factors that might be driving that symptom that led them to present.
Well, at the risk of not being too helpful, I would say yes to all of that. I would say, like, you wouldn't isolate them, and you try to do all of them at the same time. So you're always actively trying to treat symptoms while trying to figure out what happened this time. Why did they become like, right, and exactly like you said, was the medication not the right medication? Were they not on enough of it? Did they stop their medication, which is one of, in my experience, the most common reason that people become suicidal or symptomatic in general again is non-compliance with their medication. Right. So you're actively trying to assess that so that you can try to make sure the same thing doesn't happen in the future, and you're simultaneously trying to treat the symptoms. So I would say it's not one or the other. It's all, it's all together. Because that may alter your treatment. If someone's not compliant with medication frequently, then you may want to consider like a long-acting injectable antipsychotic or something like that, because you use antipsychotics to treat bipolar disorder as well, including bipolar depression.
Okay, got it. Going back to the use of lithium, is that prescribed to like treat the acute symptom? Because I understood lithium to also be used as a maintenance therapy as well.
Yes, lithium not only has the most evidence for the treatment of acute symptoms of bipolar, but also for maintenance, for chronic symptoms of bipolar too. So you really prescribe it for both. Okay.
And would you use it, like let's say a patient is on maintenance therapy with Depakote, but they present with, suicidality, would you prescribe lithium on top of that maintenance therapy and treat concomitantly with both agents, or would you switch the patient to only lithium? How do you make that treatment decision?
Okay, so the first thing I would do is try to look at their history. Have they been on Depakote for a while and never been suicidal before? If so, I would look and what's great about Depakote and lithium is you can check their blood levels, and that will tell you kind of if they're being compliant. And if I think this was, if this person was on Depakote for 5 years and they were on it and they were never suicidal, and now I see their level is low and they are suicidal, well, okay, then maybe it's not the Depakote's problem. Maybe Depakote was doing a fine job. They just, weren't taking it properly. So then we kind of talk to them about compliance. If, however, their Depakote level is good and they're still having suicidal thoughts even with that, there's a couple ways to go. There's really two ways to go. One is to add an antipsychotic on top of the Depakote, because there's definite evidence that the best treatment for an acute bipolar episode, manic or depressive, is an antipsychotic plus lithium or Depakote. So it's true drug therapy. Not for maintenance, but for acute treatment. So you would either add an antipsychotic, or I would say you could switch them to lithium and add an antipsychotic to that. But there's strong evidence for an acute bipolar, depressed, or manic episode. It should be 2-drug therapy, antipsychotic plus lithium or Depakote. So either way, I'd be adding an antipsychotic. Whether I switch them to Depakote or lithium, again, depends how effective Depakote's been. If this person's been on Depakote for 2 years and their levels are always good, but every 6 months they're feeling very suicidal again, well, of course, this is not a good thing to keep them on.